Hi, my name's Kate. I'm an exercise physiologist in the cardiac rehab department. I have some information, a few slides to share with you about hypertension or high blood pressure. So how do we define high blood pressure? On the left of the screen here, you can see a chart basically of cutoffs to define high blood pressure. So when you get your blood pressure checked in the doctor's office, comparing that reading to this chart is going to identify a normal blood pressure or possibly an elevated blood pressure. Notice that the reading, both the systolic blood pressure and the diastolic blood pressure, are taken into account in categorizing high blood pressure. So you see that if your systolic pressure is elevated or your diastolic pressure is elevated, that could potentially put you in the category of high blood pressure. So both numbers are very important. These 2017 blood pressure guidelines include a bit of an algorithm here on the rest of the slide. This algorithm is really geared towards the primary prevention world. So we're talking about patients who do not have a history of heart disease. What steps would be taken to address, normal blood pressure or an elevated blood pressure? Normal blood pressure in a person who does not have heart disease, they're simply going to be monitored at their annual checkup. Someone who has an elevated blood pressure will be encouraged to make some healthy lifestyle changes that we'll talk about later in the presentation and assess their blood pressure. If someone has high blood pressure, they're going to be encouraged to make those lifestyle changes, take a closer look at their overall cardiovascular risk, and also potentially introduce some medication. So in cardiac rehab, we're really talking about what's referred to as secondary prevention. Most patients who are enrolled in cardiac rehab already have demonstrated an event, so they have heart disease. So we will more quickly introduce medication because of the other many benefits that medications for blood pressure can impart. But we also do want to focus on those lifestyle changes really to improve the benefit of those medications and possibly even consider reducing medications. A lot of people who start cardiac rehab tell me that they'd love to not take so many medications. So the key in reducing medications is your lifestyle and what can you do to lower your blood pressure. But before we get to that, let's just touch on, why is high blood pressure so harmful to the heart and cardiovascular system, as well as other organs? Well, specifically to the heart and cardiovascular system, that high blood pressure reading really indicates that your heart is working harder. And what happens after a muscle has to work hard for so long is that it might thicken, and that makes it less effective as a muscular pump to circulate blood through the cardiovascular system. The blood vessels also tend to weaken and lose their elasticity. So they're not as adaptable to different stresses like exercise or stress. And also this stress can lead to plaque buildup and rupture. That cardiovascular vessel, the changes that occur in the vessels can also affect your brain. So the arteries that supply the brain with blood can also be damaged by high blood pressure, and that could lead to a stroke. Same thing with the arteries that supply the kidneys with blood. As they are damaged, that can lead to progressive kidney failure. So some serious adverse effects of high blood pressure. Some different causes of hypertension. It is hereditary. If your parents have high blood pressure, it's likely that you might also develop high blood pressure. Men are more likely to develop high blood pressure. As we age, it becomes more likely that we will develop high blood pressure. Certain races are more at risk. Extra body weight or obesity causes your blood pressure to increase. Someone who's sensitive to sodium, salt. Some people are more sensitive than others. A high sodium meal can really bring up your blood pressure. And also regular alcohol consumption can also contribute to hypertension. So some of those lifestyle changes that I alluded to earlier are listed here on this screen. Some might not come as a great surprise, as you saw some of the causes of hypertension. One, if you're overweight, lose weight. Very minor weight loss can make a big change in your blood pressure, as little as 10%. Reducing your sodium intake. So for the general population, we might recommend consuming no more than 2,200 milligrams per day of sodium. But if you have high blood pressure, something even lower, 1,500 milligrams per day, can make an even bigger impact. Other nutritional guidelines, the DASH diet is a dietary plan that is supportive of a low blood pressure. So lots of fruits and vegetables, whole grains, poultry, fish, nuts, those types of food tend to be high in potassium and magnesium, which can lower blood pressure. A diet that's low in fat and also added sugars, sweets, red meats, all those components are supportive of managing your blood pressure. And then again, not surprisingly, reducing excessive alcohol intake to something that's more of a moderate intake. So we're talking about no more than 2 servings of alcohol for men, 1 for women. And then, of course, the other treatment for hypertension would be medications. So many of our patients are on 1 or more blood pressure medications. Often the approach is multiple medications to lower blood pressure. Each of these classes of medications does something a little bit different within your cardiovascular system or your heart. So ACE inhibitors, diuretics, beta blockers, calcium channel blockers, and angiotensin II receptor blockers, or ARBs. Those are the many different types of medications that are effective to prescribe for lowering blood pressure. If you're on these medications, it's important that you take them exactly as prescribed. Don't miss your doses. Set a timer on your phone. Use a pill box that shows you what you should take in the morning and in the evening. Whatever strategy you need to ensure that you don't miss the doses of medication. If you feel like your medication might need to be changed, it's very important that you contact your provider first before making any changes yourself. Thank you for tuning in.